So with that, I wanted to share, I worked in the Valley for 6 weeks with Dr. Marsha Griffin. And during this time, I worked with her with an organization called Community for Children. And this organization is similar, it has a kindred spirit to Doctors for Change in the sense of working in the community and providing education. And so I feel very fortunate today to have Dr. Griffin come speak and share her experiences about working on the border and how we can advocate. Thank you.
Okay, well, I'm very excited to be here as well, and there's some very familiar faces in the audience as well. When Padma, can I put this here?
Yeah.
Okay. Yeah, because I wave my hands a lot. So I live on the border, and there's a lot of those guys back there. It's Wilson and Stephen, right? Well, there's a lot of them on every corner, and they're scaring the dookie out of all the rest of us. So that is kind of one reality on the border. So tonight, really what I wanted to do was spend some time talking about avenues for advocacy, some of the stuff that's happening on the border, and because I am a co-chair of the Immigrant Health Special Interest Group with the American Academy of Pediatrics, so it's about 400 physicians of the 66,000 that are in the Academy. So that group kind of has regular meetings, and on the phone we do a lot of advocacy. We do, some of us are the authorized speakers for the Academy on immigrant and refugee issues. So that gives us some access to immigration attorneys and child advocates for immigrant children across the country. So there are there's two of us who are co-chairs, Dr. Julie Linton, who's from North Carolina. Alan Shapiro also works with us really closely, and he's from Montefiore. But we are on a detention listserv to end detention of children. And so we have bi-weekly, is that right? Bi-monthly? Every 2 weeks we're on the phone, and we have advocates that are in Billy and Carnes, those are the family detention centers, and in Berks in Pennsylvania. And so it is a way for the doctors and the lawyers across the country that have been advocating for these children can get on the phone and go, and now what do we do? And now what do we do? So tomorrow during Grand Round at Texas Children's, I'm really going to be giving you some of the many ways that these children are traumatized, whether they're traumatized in their home country, which causes them to flee, or on their journey, which causes a lot of violence and suffering on the way, or that those two guys back there are causing a lot of trauma within the Border Patrol processing centers and when picking up families. And I say this with many in our community are Border Patrol agents, and they're fabulous, and many of them are fabulous human beings who care greatly about children. And honestly, they don't want to be picking up children. They're a law enforcement agency, not a child care facility. And in speaking with them, which I've gone on many escorted tours into the processing centers with them, what they would prefer to do is go back to catching the bad guys and have somebody else deal with the children. They're ill-equipped, they're not trained, and so there's enough bad apples that are with Stephen and Wilson who are good guys, but there are enough bad apples that cause a lot of problems, and there's no accountability. So there's been maybe, I'm going to get my numbers wrong, over 50 people who have been killed by the Border Patrol. There's no trial, there's no accounting for the killing of these people. So this is one thing that the attorneys are fighting, and we're fighting with them, that there's more accountability. So since I was here actually and went to Baylor for my residency and then left, and I went down to the border, and since I went down there and I worked in a federally qualified health center for 10 years, and almost every one of my kids were either immigrant children who were undocumented, or they were U.S. citizens who their parents were undocumented. Many of you see them in the medical vans that go from Baylor out into the community that PAVMA goes on. So that was my kids, and there is nothing I love better. They're the most beautiful, the mothers are the best mothers, and you know, I love that population. A year ago, I went over to become full-time professor faculty at the University of Texas Rio Grande Valley School of Medicine. So I teach there and put together grants and programs to serve this population. So I spend most of my time looking at data and writing grants so that we can provide better care on the border and do research globally with others who are doing this kind of research. Since I went down there, the hate spewing, who all of you see up here, didn't used to happen. And I used to be able to get a kid who needed a higher level of care, and I could transport them by ambulance or air flight them to Texas Children's or San Antonio or Driscoll without a problem. I gave them a letter. The accepting doctor gave the family a letter. We're going to see these kids, and they would wave them through the checkpoints. There's a checkpoint 90 miles north of the border, and it is on most accesses across the southern border. That quit happening after 9/11. It started getting worse. I could still get my kids there, but slowly, but methodically, I would say, that quit happening. So we had parents that were deported and taken off in an ambulance as their child was being taken north. And at one time, I mean, I have been known to do some kind of, I wouldn't say questionable, you guys can leave the room now, but yeah. We knew that they would get stopped at the Border Patrol, so we would air flight them over the Border Patrol and explain how they were to interact when they left and when they got there. And those didn't happen very many times. I can tell you I'd do it again to get kids north. The problem on the border is that because there's so many Border Patrol and Department of Public Safety working with the Border Patrol, that it is dangerous for our families to be out there in public because they can be deported and on the other side in 5 minutes. And so it's not, you have a little buffer by being in Houston or being farther north that we don't have down there. So they're asking for their papers. Border Patrol or DPS is asking for papers if they're just walking down the street. If they're walking their kids to school, the mother might be asked if she's got her papers. And so those things are kind of going on all the time. I would be very, very circumspect about rumors that you hear, because we need to be very diligent that we're not sharing information that's not quite true until we know exactly what happened. For instance, there was an email that went around to a lot of people saying that 3 families in Driscoll ICE went into the hospital. They were taken there, they'd been air transported from Brownsville, where I live, to Driscoll, to the preemie clinic, to NICU, and that ICE had stopped them in the hall, asked for their papers. They didn't deport them, but asked for their papers. In talking with the attorneys, so people were sending that to me going, what's up? You know, we really need to know what's the baby's name, what's the date of birth, we can call the hospital and get the information from social workers. But for us to just say, that really happened, we don't know if the family had a criminal record. We don't know if ICE actually was in the hospital or somewhere near. So until we have the detail, I would say to everybody, we need to be the calm ones that say we're looking into this and we'll get back with you when we know the information. We still don't have the information on this family. Apparently there was one family, but we still don't have the details of exactly what transpired. I can tell you that because it's so bad on the border, that we have legal teams that come down or that are going into the colonias, which are unincorporated communities along the border who don't have a lot of infrastructure, so they may not have electricity, water, those kind of things. But they are having community meetings in safe places where people often gather for other reasons. And they're helping the parents with guardianship and powers of attorney. They've always come in and done Know Your Rights, how to get prepared, what you should have, and y'all have those up here. But it makes me gasp to think that I would have to go to a meeting like that and be doing papers for my 3 girls to say who's going to keep them when I disappear, and then how do I talk to my girls? How do I explain to them what might happen? How do I keep them from being hysterical because I'm hysterical? So those kind of meetings are happening all the time. UNHCR, the United Nations High Commission on Refugees, is there right now, so they've been meeting with many of us in the community. Migrant Clinician Network, who does a lot of coordination of refugee and immigrant care, was just down last week. We get a lot of news down there, so BBC, NPR, Germany, Denmark, all of them are a lot of times down there to find out what exactly is going on. The DPS and the Border Patrol actually right now are denying people the right to come into the country, even if they present and say, I'm seeking asylum and this is what happened. They're telling people that there will be no asylum under Trump, and they're turning them away. So sometimes families have been turned away 3 or 4 times, then they end up being kidnapped, then they end up having something horrible happen to them, or then they're forced to cross the river by swimming. And at that time, if you come across the bridge, any of the bridge, that's an authorized port of entry. And so that's allowed, really. It's legal. It's not illegal to come to the border. But if you swim across, if you come across at a different place, now you have an extra charge against you, and that can be seen as a criminal charge. So a lot of times when they say they're criminal, it's because they force them to swim across the river instead of coming to the port because they're refusing it. So we have a lot of attorneys that are on the bridges right now taking cases and talking to people and filing lawsuits against the government, just so y'all know back there. And so that's going on. I was out with ProBar this week, and ProBar is a organization that provides legal representation and know your rights for the unaccompanied children in the Office of Refugee and Resettlement Shelters, and there are many in the Valley. And we have Community for Children always. Our residents and fellows and medical students are always, when they're down, are working in these facilities to get the stories, to know, to be our advocates and ambassadors across the country. So they're often there to make sure medical care is really the kind of medical care that we would think is standard of care. It's not always. Those things, they're also teaching. They're teaching health and sex ed and that kind of thing. So they always love this. They're also working with the attorneys on difficult cases, perhaps on gang rape cases by the cartels when they cross through Mexico, and explaining to attorneys a medical record because the attorneys don't understand it, or they're doing lit searches on why a young girl would not tell a Border Patrol the first time they see him, oh, by the way, I was gang raped last night. it may take a while before she actually discloses. So we give them that extra amount of research so that they can win their asylum cases. And to let you know some of the things that are going on right now, there was a big order. There was a big hearing on June 27th, and there is a judge, Judge Dolly G., who has heard the cases against ICE or Border Patrol for violating the Flores Agreement. I don't have time to go into the Flores Agreement, but years ago, children were being physically and sexually abused in ICE facilities. It was then called IHS, Immigration and whatever. INS, thank you very much. INS, and there was a lot of abuse, and so there was a lot of lawsuits that got filed, and they divided that, so children, unaccompanied children, are supposed to go to the Office of Refugee Resettlement. ICE is only supposed to have them for a short time, so it's very complicated. I'll be going into a little bit of that tomorrow. But so Judge Dolly G. has stated many times that ICE and Border Patrol are violating the Flores Agreement, and they were supposed to be changing things within those facilities. There are some facilities, though. The Central Processing Center in McAllen, Texas, is one of the most horrific places that an immigrant could find themselves in. And so what goes on in there is it's a big space, well, not terribly big, but it's big, and there's a horseshoe around, and there's like 8 rooms, and each of those 8 rooms are like 15 by 15, and there are maybe 40 people in there, mothers with their kids or fathers with their kids. They get separated in there. But there's no amenities. There's no showers. There's an open toilet. So in that room of, say, 15 by 15, there's an open toilet with a wall that's about that high. And you have to pee or poop in front of everybody else. And they don't have decent food, so they give them white bread with a slice of ham in it, and they throw it on the concrete floor. So when we see them in the community, in some of the respite centers, humanitarian centers, for instance at Sacred Heart, the kids are dehydrated, or they have the mothers have urinary tract infections, or they're constipated. So we're treating a lot of symptoms of what happens in there. Well, there's been a lot of lawsuits, and there's been some things on how they should be treated, but they are not doing their job, and they're not monitoring it, and they're not making any changes. So 2 weeks ago, Judge Dolly G. gave an order and said that particular processing center, which is my neighborhood, it's Texas, it's us, that they were violating every one of the Flores agreements. And the one that there's 2, there's a Central Processing Center, and then there's Ursula. Ursula is the nice place. They think it's improved. It's like a large Walmart, gutted, with cages in it. And the immigrants stay in cages with chain link fence, kind of up to where the ceiling is. And they're locked. So if you think a bigger cage is an improvement, it's still a cage. But in the Central Processing Center, it's draconian. I mean, it's really horrible. She cited all of them. The attorney for Border Patrol, for Manuel Padilla, who would be your boss down there, they had said, that it's so cold, and they're sleeping on the floor without a blanket, without a pillow, and it's cold, and their kids are on the concrete floor, freezing, and they can't sleep. And the attorney for the government actually said there is nothing in the Flores Agreement that states about sleep. We don't have to care about sleep. for the children. So the Flores Agreement is all about taking care of kids. And that's the mentality. And so that is going on. So we have this order that just came out, and I sent it to, so you know kind of the advocacy, because you guys are a great advocacy organization here. Padma has been telling me about you since she was down last summer. So for 1 year, I've been hearing how great y'all are. And so I wanted you to know some of the things that are going on nationally and state that are working on these issues. So I sent, and because Padma was there when all the leaders came down to look at these places, to know what kind of conditions the children were being held in. So it was like Bernard Stein, who was then the president of AAP, Bernard Dreyer, Fernando Stein, who, as you all know, is now the president and from here. There were 3 former presidents of the Texas Pediatric Society and the sitting president, and 4, including Padma, of the Immigrant Special Interest Group. And the Border Patrol denied us entrance into this facility twice. We got to go into Ursula, but not into the really bad place. So when the order came, and on this phone call this week, I was informed by the attorneys that the order had been issued. I sent it to Fernando and Joyce Mock, who is the president of Texas Pediatrics. They both went into urgent mode. So they were having kind of very, very high-level meetings today and tomorrow to decide what the response is going to be from our 2 organizations, because they want to be involved. She ordered, the judge ordered that there has to be monitors, which we've been advocating for years. And now what I think that we should do is we should be the monitors. Pediatrician team that's designated, that could walk in any hour of the day or night, unannounced, that they don't have to get approved every single time and get permission to walk in the door to see how the kids are. So those are kind of some. What we've decided is that we've got to start looking at the situation in this country differently, and we're going to be strategizing on how to do that in Chicago at the national conference on what can we do globally. This is a global issue. It's not just our issue. And so we've got to think about the power of physicians, all physicians around the globe, to fight for this together. What can we do nationally? The Academy is full of members who are from other countries, to get them to organize their countries to advocate with us. And then locally, from everything that you're doing down to the simple things like bumper stickers and all are welcome and buttons, and us being allowed a voice as the other side is being allowed a voice. There's a lot of Community for Children advocates. There's over almost 120 across the country now that are also speaking up and have been publishing about this. Dr. Sao from Chicago has an article that, in the perspective article in the Pediatrics that is coming out, I don't know if it's this month or next month, on going to court with a child who is alone, and sitting in the court and watching them go before a hostile judge, and what that is like for the child, and what it's like every time I take residents, for the most part they leave weeping, that how could we think that this is okay to do. My time is up. I have lots more to talk about, but we can talk later. Thank you for inviting me. It's a great pleasure.